when we talk about an ear infection, it's typically a middle ear infection, which is a space inside the ear, kind of right behind the eardrum. And what happens there is that fluid builds up, bacteria live in that, and that causes some pressure, some inflammation, and along with that, kids will have some pain as well as a fever as the body fights off the infection. Now, while ear infections can happen to anyone, they typically happen more frequently in younger children, specifically kids under about the age of 6 or so. If your child isn't, able to talk, it's kind of difficult to tell if the ear hurts. So if you see a difference, if the child is playing with the ear more, seems more fussy, is crying, having trouble sleeping, or sometimes having trouble eating, that might be a sign that there's an ear infection going on that your doctor would want to go ahead and see. If your child is older, your doctor may say, well, go ahead and wait a couple of days before we treat. And the reason for this is that many of these infections are actually caused by a virus. And for viruses, antibiotics don't work. So for an older child, the recommendations from the Academy of Pediatrics are to go ahead and in some cases wait for a couple of days before treating, just to give the infection a chance to get better by itself, so that the child isn't exposed to antibiotics if she doesn't need it. So this is one case where it's very important to go ahead and take the medications as prescribed, including finishing them up completely. If you stop the antibiotic too soon, sometimes this will cause the child to initially seem better because the antibiotic is working, but then when you stop it, that infection is going to come right back. And sometimes this can also encourage the growth of resistant bacteria that would then require a different, stronger antibiotic. Even after the child is feeling better, it's important to go ahead and make sure that you follow up with your pediatrician afterwards to make sure that the infection has cleared up and that the fluid that's in the ear has gone away as well. So if you don't see a resolution in symptoms, that the child seems sicker or hasn't improved, it'd be important after a couple of days to go ahead and call your doctor as well. Now, as kids get older, they tend to get less upper respiratory infections, and ear infections also become a little bit less frequently. So typically by 6 to 8 years, we don't see them as much, but they can still happen, even in grown-ups. So the important thing here is that if you start to see these symptoms, if you think that there's something more than a cold going on, go ahead, call your doctor, come on in, and we'll get everything checked out.